Hello study buddies, welcome to the third video of Pharma Girls. Today we'll be talking about glucocorticoids and in general this takes place in the anti-inflammatory fire department, specifically the gym, so you'll see some gym references and I hope those help you to link information together. There is a lot of information, so I'll try to cover everything and I'll have a separate video for the mechanism of action. So let's start now with the general concepts. To begin, glucocorticoids, I'm talking specifically about glucocorticoids. So they are the most potent anti-inflammatory. As you can see here, they get the most potent award. And also, they are immunosuppressive. I drew it as a representation with this. I don't know if it actually shows, but you can see the pathogens getting inside because of the tension, suppression, whatever you will call it. It's a stretch. Quite literally a stretch, but keep that in mind. So they're anti-inflammatory and immunosuppressive. Over here we have steroidal anti-inflammatory drug of the month, glucocorticoids, mineralocorticoids, and this represents the, the primary endogenous glucocorticoids and mineralocorticoids. So for the glucocorticoids, the primary endogenous one is cortisol. As we know, it has another name, hydrocortisone. And as you can see, this little girly over here is her, but in uniform, because we're going to be talking about hydrocortisone. Although it is an endogenous glucocorticoid, it affects both glucocorticoid and mineralocorticoid receptors, whereas aldosterone only affects mineralocorticoid receptors. Also, there's a fact that they are mostly synthetic. Do with that information what you will. And you should go back to the slides because there's more information about the synthetic. Something you should also know is that all of them are lipid soluble, and that the majority are binded to plasma proteins. These plasma proteins are called corticosteroid binding globulin. I'll also get into that as we go on. There are also in the slides side effects. I didn't include those in this drawing, so please go back to those. So glucocorticoids are classified according to their duration of action. So we have the short acting. She's literally short because of that. We have intermediate acting, which have these two. And lastly, we have long acting with dexamethasone. Now let's start with our short acting drug, hydrocortisone. So the two thumbs here represent that it is not very selective. So as you can see here, as we go this way, we have increasing potency, and increasing selectivity. So here, hydrocortisone is not selective, as we said before, acts on both glucocorticoid receptors and mineralocorticoid receptors. Oops. Also, from the t-shirt over here, you could see it causes sodium retention, which could give people the risk of edema. And it's relatively short acting, so its duration is 8 to 12 hours. Also, hydrocortisone can be used either orally, topically, or IV. So see, she does not discriminate. Not only does she use both receptors, also many modes of administration. And something important to note is that for topically, it's used to treat eczema. As you can see here, مكتوب eczema, بس يعني you can add it clearer. And also that hydrocortisone is used as replacement therapy to treat patients who lack adequate endogenous cortisol, because as we said, hydrocortisone is basically cortisol. So if someone lacks it, we can administer hydrocortisone to them. On to the next. Here we have prednisone and prednisolone. So صالون عشان كده يعني تلاحظون كشخين. So prednisone is the prodrug of prednisolone. A fact that the doctor said is that we use prednisone sometimes because it is cheaper. A fact that you need to know is that this prodrug is metabolized in the liver to prednisolone. So if we have a patient who has liver failure, you should not administer prednisone to them because they can't convert it to prednisolone. So these two drugs, they are orally effective and they have a longer half-life, therefore they are their duration of action is longer, with 18 to 36 hours in comparison to the 8 to 12 hours of hydrocortisone. They are also more potent. We said as we go this way, we have more potency, and more selectivity. So they are also more selective. They are anti-inflammatory, because we said they're all anti-inflammatory, but they have less myocardial adverse effects. So عشان تربطونها, they don't look approachable, just look at their faces. So less myocardial adverse effects, يعني ما عندهم قلب شوي, they're cold-hearted, so less myocardial adverse effects. Also, they have less electrolyte disturbance. You can like تربطونه by seeing how uniform they look. They look very similar. So there is less electrolyte disturbance. And they're really trying to one-up hydrocortisone. So they have less edema. A fact that you should know about prednisolone is that it's usually given in the morning. It's given a morning dose because it interferes less with sleep, and 2/3 production of cortisol is in the morning. Therefore, it's given as a morning dose. I just remembered something, right? So as you can see, their hair over here represents the doses that they're given. So for prednisolone and prednisone, they're both given 1 dose daily. And this characteristic is important because 1 dose daily means that it increases compliance of patients. Whereas hydrocortisone here, she has many braids, many braids. That means you have many doses daily. So their hair here represents the doses that are the doses that are given. Lastly, we have dexamethasone, and dexamethasone here has the longest duration of action with 48 hours. And remember when we said, as we go here, we have increased potency. So dexamethasone here is the most potent. And what contributes to that is, let's go to the first slide. As you can see, hydrocortisone has a gym bag. Prednisolone also has a gym bag. These gym bags represent the corticoid binding globulin. And this corticoid binding globulin, it inhibits the drug's ability to enter the cell membrane. So it inhibits this ability. But here, as we can see, dexamethasone, she doesn't have a gym bag. So she's quicker, she can enter the cell, she can cross the cell membrane much more quicker, which makes her much more potent. And we also said that as we go here, we have increasing potency and selectivity. So she's very selective to what? Very selective to glucocorticoid receptors. And as we can see, in comparison to hydrocortisone, who has high sodium retaining properties, on the other hand here, dexamethasone has low sodium retaining properties, which makes her a great treatment for cerebral edema. Specifically, cerebral edema associated with bacterial meningitis. Keep that in mind. Bacterial meningitis. One adverse effect of dexamethasone is that she's very immunosuppressive, which increases the body's risk to super infection. You can see here. Something also is that dexamethasone can be given as eye drops to treat inflammation of the eyes. There's also budesonide. I'm not going to attempt that, but this is also a long-acting glucocorticoid, which is used as an oral inhalation. So oral inhalation of this drug is used for bronchial asthma. But as the doctor said, we don't need to know anything about this drug. Now, in general, as you can see, I added for all these girls blush. And this blush represents something else we covered before, which are peptic ulcers. But this time I really didn't want to give anyone pink hair because all of them cause peptic ulcers. That's why it's important to use antacid medications before using glucocorticoid drugs. And also there are some contraindications for these drugs. These contraindications are osteoporosis, ocular viral infections such as the herpes simple, and lastly, live virus vaccination. And something to know is that these drugs in general treat several anti-inflammatory diseases, such as ones we have covered before, rheumatoid arthritis and gout. And also because they are immunosuppressive, I'll write this down, because they are immunosuppressive, they can also treat, do you remember this butterfly rash? They treat SLE, and they also treat something called psoriasis. I don't know if I'm pronouncing that correctly, but this is characterized by a rash on the body. And although I drew it on the girls, just know that it treats psoriasis and systemic lupus erythema. And also, I don't know how to include this, but these drugs prevent organ transplant rejection. Something you've probably noticed throughout this whole video is here, hydrocortisone. A low dose of hydrocortisone is effective in treatment of Addison's disease. Why do we use a low dose? To have less side effects. I hope with this I've covered these 3 drugs, and I will be uploading a video of the mechanism of action right after this.